Hello everyone, I am back with another topic, that is increased ICP. ICP stands for intracranial pressure. This is the pressure of fluid within the cranium, that is within your brain tissue. The normal ICP is 5 to 15 mm of Hg. If it increases over 15, then we will consider it as increased ICP. So increased ICP usually occurs due to crushed brain or crushing brain injury. It can also increase due to some infections such as meningitis. There are some key signs or the signs that you will find in the early stage of increased ICP. It includes altered mental status. Your patient will have altered mental status or altered level of consciousness. Next sign is agitation. Patient may feel agitated, irritable, and the most importantly sign is vomiting. The thing that you have to keep in mind is the patient will have the sign or will have the episodes of vomiting, but those episodes will develop or will occur without nausea. Patient will not feel nausea. That usually happens when patient vomits. So this is the early sign of increased ICP. Next are the late signs of increased ICP. Those late signs includes Cushing triad. Cushing triad stands for, or you can memorize it as crushing triad. In this, your vital signs or your vital functions are getting crushed. So first vital function of our body is respiration. In this, patient will have bradypnea, means decreased level of respiratory rate. So it will be less than 10 per minute, and have bradycardia, crushed heart rate or decreased heart rate patient will have. The third in this Cushing triad, the third sign is widened pulse pressure. Pulse pressure basically means the difference between systolic and diastolic BP. So in this patient will have widened pulse pressure. Systolic blood pressure will be high as compared to the low BP. These two will not increase simultaneously. Next are the late deadly signs of increased ICP. In these late deadly signs, the first thing you have to check is the movement of patient's eye. That your patient will have fixed eyes. Normally, what happen is when you are looking straight, you are looking at any object, when you will move your head around, your eyes will move against that movement of your head. So while you are looking at one position, like I am looking at this finger, I have to look, my eyes will be on this finger, but this will be absent in your patient if your patient's in ICP is increased. Diameter of pupil will be more than 8 mm. Next, in your adult patient, you will see the Babinski's reflex. In adult patient, if there is presence of Babinski's reflex, this may indicate you that your patient is having increased ICP. So these are some common signs of increased ICP. Interventions for increased ICP includes, first thing is you have to immobilize the patient wherever the patient is. You have to immobilize the patient, or while moving the patient from one surface to another surface, you have to move the patient as a single unit or provide the patient a neutral position. Always keep the patient's head up, because if you will lower the head, it may increase the pressure inside the cranial cavity. So you have to keep the patient's head side always up. Remember this. Next is, on ventilator setting, you have to hyperventilate the patient or increase the respiratory rate in order to decrease the carbon dioxide level, because decreased carbon dioxide level will cause vasodilation. Vasodilation will help to decrease the pressure within the cranium. Big no-nos to follow for the patient with increased ICP include, patient is not allowed to blow the nose, so it may also increase the pressure within the cranial cavity. Next is Valsalva maneuvers are not allowed. Well, in the Valsalva maneuver, what we do is we used to blow, like you patient who are constipated, they try out to poop out. So in those cases, patient's ICP may increase. Next thing you have to keep in mind is administer laxatives to decrease the risk of constipation and hence decrease the risk of increased ICP. There is no contraindication for deep breathing, yes, but blowing the nose, Valsalva maneuvers, flexing and bending of extremities is contraindicated in patients who are having increased ICP. So this is all about the topic. Please like and share this video if you get to learn something from my video.